pop myself up on the screen. Here I am again. Hello, Dr. Earl Stephenson Jr. And today's question revolves around a young lady. She asked, should I do fat grafting, lower bleph, a SOOF lift, which is lifting the cheek basically, or all of it? And let's bring up her picture. Here's a young lady who has what I'm going to call a very dowdy or tired appearance to her face. So what I said to her was the following. First and foremost, you may have a lot of problems that you perceive, but it may not be fat. You first have to look at swelling that you have underneath the eye. If you look on the middle pictures, you can see an obvious area of swelling in a line that kind of demarcates the cheek and the eyelid. That could be from allergies or allergic reactions. So if that's a component, you got to get that under control. See an allergist, make sure that that's good. These may be considered festoons. Festoons are kind of a collection of fluid and edema, just a little bit below the natural eyelid. Very difficult to treat. No really standard treatment. So gotta consider that. You may need some cheek support. You may that the bony cheek may be flat and need to be, elevated or built up, whether that's with filler or you can do custom facial implants. And I specialize in custom facial implants. That kind of goes with my additional training as an oral and maxillofacial surgeon. I think you need to kind of talk about the not just the under eye, but the the upper eye. Her brow looks a little heavy. It gives her a little fullness and gives her a little heaviness and closeness or a closed appearance to her eye. So taking a little skin out, maybe a little fat. Sometimes the gland here that causes tears needs to be kind of repositioned so it doesn't fill up this area and kind of make it look full. That certainly needs to be addressed. But I think the most important thing that I would tell her and that I told her is that many young patients do much better with preserving fat. If this is fat and it's going to be removed, along with additional skin, that preserving fat and redistributing it so that it gives you a softer appearance is much better than aggressively removing it. That sometimes in younger patients creates a much more unnatural result. So uh, always, 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 even though I've given my opinion, I think that she probably needs to consider upper eyelid surgery, upper bleph, maybe brow repositioning. She definitely needs to control her allergies if that's a component. And she definitely needs to consider if this is a bony problem, is this a swelling problem from not just allergies, but festoons, or if this truly is fat and this fat needs to be repositioned. But nonetheless, it's always required, and I always, always say this, that no matter what questions that are presented to me or people ask me for recommendations without coming to see me, always preference that with you gotta see a board certified plastic surgeon. Love for you to see me. If you're not in the area, please see two, three board certified plastic surgeons to get a physical exam, go over your history, and make sure that you can get the best and most accurate recommendations for your particular situation. So again, I'd like to thank you for this Q&A. I hope that kind of shows you a little bit of the thinking. Brows a little heavy, upper eyelids a little heavy. This may not be fat, maybe swelling, maybe not enough support of her cheek. So those are things to think about. So we'll see you next time on Real Self, not Real Self, but real questions, real answers, and real surgical thinking. See you next time.